All right, the last little part of this, I ended up talking a little bit about symptoms and actions to take related to increased coagulation, that anticoagulation that occurs post dialysis. In the course of dialysis, they're getting quite a bit of heparin therapy to keep the blood moving through the dialysis system, and so it's very common for patients to have symptoms that you would typically see with hyper anticoagulation states. They may have nosebleeds, they may have some GI bleeding symptoms, they might even have some instability that you can tie back to there's some internal bleeding going on in a certain location. And so it's imperative that you recognize these symptoms and treat accordingly. Now, when someone's having a nosebleed or an active bleed from a certain location, obviously the first thing we think of is, how am I going to control the bleeding? This is not like bleeding like you would have sometimes after some kind of a surgery or procedure, because the blood is anticoagulated. So irregardless of it, whether you're holding pressure or things like that, that's not going to make the biggest difference. And I'm going to let you guys go and look at the literature. What is the antidote that you're going to give patients when they are hyper anticoagulated? All right, next thing, medication administration timing related to dialysis treatments. Do some research on that. There are medications, you can imagine when you dialyze somebody, that there are metabolites of drugs that if you gave those medications right before somebody went to dialysis, they either would barely be absorbed, but then you cleanse the blood and you're taking the drug right back out of their system. So you really want to think about some of the medications that you might give before or after a treatment. And also think about things like, we've mentioned that people come back sometimes hypovolemic, sometimes hypotension. So you might hold their medications for, say that if they have hypertension, you might have held those before the case to go down for dialysis, knowing that they're going to drop a little bit. Now, they might come back from dialysis, and initially their blood pressure may be low. So, would you go ahead and give blood pressure medication knowing those circumstances, or would you wait and kind of delay that and wait to see when they're going to give that daily med, maybe later in the day on a dialysis day? In some places, the dialysis team makes the decision because they're in the computer system also, and they may give medications after the treatment to catch medications up. So it's always really important to get a good handoff communication from that dialysis nurse that lets you know how much fluid did you take off, what kind of vital signs did they have down there for you, and what condition in terms of any of those issues that can come from dialysis might you be just about ready to inherit, so that you're prepared to give medications, make up things that haven't been done, because they are off the unit sometimes for several hours. Next, key teaching points for rheumatoid arthritis patients. How do they take care of themselves at home? What are some of the key things you want to make sure that they really understand about rheumatoid arthritis? What kind of disease is it? We know it's an inflammatory, autoimmune driven disease. It's not something that flares up and they just never have it again. It's going to be chronic. So just really look through that in terms of what does your book talk about that would be key, that you would educate a patient about the disease itself. What is it going to lead to? How is it treated? Those kind of things. There are some non-pharmacological measures that are given or provided. Some of those are complementary alternative treatments. Make sure that you're familiar with which ones that are given or used for fibromyalgia to kind of help with pain relief or distraction. Also know what are some of the late manifestations that you will see with rheumatoid arthritis. Go back and look through to see what are the procedural steps in self-catheterization that make sure that when you're teaching the patient how to do a self-catheterization, how to do that safely and not to contaminate themselves. And in the home setting, self-cath may be a little different than it is how we would do a catheterization in, a hospital setting. Patient teaching. Be familiar with what you would teach somebody with chronic kidney disease in terms of what kind of meds and diet that they may likely be on, what kind of fluid intake should they have, what do they need to do in terms of their weight, is it correct or helping or problematic, one or the other. And then we'll learn more about this when we have class the next week. Related to organ donation. So these last 4 questions, make sure that you're interactive and asking the guest speaker a little bit of that. I know there are other questions that deal with the dying process that are also in this list. Make sure that you're getting clear answers to anything that you have questions about those as well. For once, you're getting the questions before the class. Under meds, just make sure that you really are familiar with this. I tried to be as specific as I could. Know, about the different drugs. If I've specifically pointed out use, side effects, different things like that, make sure that you look all those up. And then, I guess lastly, kind of knowing some of these drug categories and what impact they might have on the urinary system and or kidney disease is important. Hopefully that will help you guys out.